you got a big booty, big, big booty, what you got a big booty.
Yes, I'm happy that you are here. Welcome to Nursing Embassy. I'm Nurse Bosco. And guys, a couple of months ago, I passed my Nclex in South Africa, and I felt like it's an opportunity for me to help my fellow nurses who are also in the quest to pass this exam. So if you are looking for someone from Africa with a real African accent who can guide you through how he passed the Nclex exams, then you are no further other than Nursing Embassy. You can also find me on Facebook. Just look for Nursing Embassy page, and then you can get to connect with me. Guys, today is Women's Day, and just know that we cherish you women. Happy Women's Day. There could be someone who is struggling with passing Sata questions. If that is your challenge, keep around so that we can go through this together.
So guys, first of all, what is a Sata question? Sata stands for select all that apply. It means that they are going to give you a question which is not typical, because typically the Nclex has questions with only 4 options, A, B, C, D, whereby you select only one correct response. However, for select all that apply questions, you are given 5 to 6 options, and you have to choose all the correct options. So it means that you have to select exactly what the correct answers or options are out of the options given, and you submit that. If you add one more or you submit one less, you don't get any marks for that. You don't get any credit. That's why I've indicated here that there is no partial credit. In other words, on the Nclex, they will not say, oh, sorry, you were almost, let's give you maybe half score. No. They will not do that. So it means you have to take the necessary precaution to make sure your submissions are accurately correct. Guys, this will continue until, nowadays there are rumors on the internet that from 2023 there will be the Nclex format will change, and there will be what we call next generation questions. So that means that those questions will not have Sata, they will be different. But until 2023, guys, you have to take the necessary precautions. Make sure what you are submitting is accurately correct. If not, then you have to wait and take your Nclex in 2023. So the other update I have to give you about Sata nowadays is that the answers, the correct responses can be one only. You can be given like 5 options, but there is only one correct option. Other times you can be given 5 options, but all of them are correct. Okay, so those of you who are doing questions on UWorld now, you have been updated on that. The options, all of them can be correct, and you can find another question where only one answer is correct out of, say, 5. Okay, so do not be misled by old review materials that say it can never be one answer. No, now actually, even on my Nclex, my personal exam, I had to select, I had like around 2 questions where I had to select all the options given, and maybe another one where I had to select only one answer. And remember, I passed at 75 questions, so most likely it means I was getting those questions. So let's go to the strategies that are very useful for passing this type of questions. Number 1 is that you have to understand your content in and out. So the more you understand, the more you know, the more you have a greater width of nursing knowledge, the more you can actually easily pass these questions. Because understanding gives you a strong basis for good judgment. So that's why I normally recommend guys that you read at least 2 content books. Read Saunders, finish it. Look for maybe Kaplan, look for McGraw-Hill. Read at least 2 content books. The other strategy, guys, is that you read the primary question very well. Read that question, read it again, and if you feel you don't understand it yet, read it a 3rd time until you really understand what that question is requiring. Failing to understand the question will direct you to the wrong options, and you will actually fail. So that is a strategy actually that I recommend for all Nclex questions. It gives you the first weapon in your hand while you are attempting a question is first of all trying to understand what the question wants. Strategy number 3 is that you should treat each option independently. Some people look at one option and then they say, but the other one down said, so I think this one must be wrong. No, treat each option independently and don't see the current option, say option number 1, in light of other options. And then never combine options. Don't say option 4 says this, so meaning option 2 is correct. No, the answers never relate with the others, so it should be treated independently. Treat each option as a true or false statement. This is a strategy that is very good. Once you understand what the question requires, then when you approach that one option, first of all ask yourself, is this really true in regard to what the question wants, or is this false? Is this a false statement in regard or in light of the question? Okay, so judge that statement, that option, whether it would make sense in light of the primary question. Okay, strategy 5, guys, is that you should practice as many Sata as possible. You know, guys, some people fail these Sata questions because actually they have the phobia. Whenever they see Sata approaching, they feel like, oh no, it shouldn't be this one. So what you should do actually is to practice. You have always heard that practice makes perfect. So the more Sata questions you practice, the more you become perfect at them, and the more that fear for them diminishes. Guys, the other option is that you should ask yourself something like this: would it help, harm, or do nothing, to the patient? Would it help the patient, harm the patient, or do nothing to the patient? Now, this especially applies to intervention questions. For example, I've given a question here. This is my own question from my head, but don't be surprised to find it on your Nclex there. Alright, so what would be done to prevent development of pressure sores for a patient in a long-term care facility? So, as we approach this question, we understand that first of all, the question needs us to select everything that is an intervention to prevent development of bed sores or pressure sores. Okay, so those are the options we are going to select, and we are going to ask ourselves that every option, would this help the patient, would it harm the patient, or do nothing to the patient? So let us go for option 1. Pull the patient to turn him to side every 2 hours. Many people would click this answer as right because they don't read the question to understand it, because some people don't read the question like twice. Some people would say to turn him to side every 2 hours, and they'll be like, that is the answer. Turn, yes, turning, and then they click. But actually, look at this keyword here, pull. Remember that patients who have been bedridden for a long time, their skin is fragile, maybe it has been in contact with urine, it breaks easily, so you don't pull that patient. This is the word that will actually tell you in this option, you, the nurse, is actually harming the patient. Please don't select that because you are harming the patient. Then next is minimize noise. Okay, for development of bed sores, would that help in any way? Would it harm? No, it wouldn't harm the patient if we minimize noise. Would it do nothing? Yes, it will do nothing in regard to prevention of development of bed sores. So I would not select that option because it does nothing to prevent development of bed sores. Then feed patient on a balanced diet. Would that help? Yes, it helps because actually when those of you who have read about the risks for bed sores, one of the risks is poor nutrition. So yes, if I feed my patient well, that patient, I will eliminate that risk for development of bed sores. Then use moisturizing cream. Yes, it will also help. It will help to prevent skin breakdown. And then use pressure equalizing mattress. That is the #1 intervention in prevention of bed sores for patients who are going to stay on the bed for a long time, because if you equalize the pressure, it means that the pressure sores will not develop easily. Okay, so that is how to use that strategy.
Watching up to this time just means that you are a very committed person. I really wish you success in your upcoming exam, and I know, I'm very sure you are going to make it. Yes, if you feel that such videos I'm making are useful, please subscribe to this channel so that YouTube will show you the videos that I'm going to record next. My next video is going to be on how to review content, how to read content, and I hope that it will be of great value to you. If you know someone who really needs this video, please share with them. Yes guys, till next time, love you all.